Hello guys, Dr. Emmanuel here, and I'm back with another video about Plab 2. Today we are going to talk about types of scenarios or stations that you find in Plab 2. Remember, yesterday we talked about the structure of Plab 2. You're going to have 16 stations. The first type of scenario you're going to have, those are called history-based station. In these types of stations, basically, you do not have the diagnosis, and what you are going to do is take a history, do an examination, ask for relevant tests, come up with a diagnosis, and manage the patient. This is what we do in history-based stations, and remember, this is going to be 8 minutes. Counseling-based stations, these are stations where the patient has a concern. They will tell you, doctor, I'm concerned about prostate cancer, or doctor, I'm concerned about breast cancer. They'll just give you a concern, and what you're going to do, you're going to give the patient advice. So for example, if they tell you, I'm concerned about let's say breast cancer, you're going to take a short history, ask them, why are you concerned about it? Is there any member of your family? So family history. And do you have any symptoms? Then based on what you have discussed with the patient, give them advice. Tell them, from what the information I've gathered from you, you do not have any risk of that condition, so you should not be worried. Or if they have a risk, tell them, unfortunately, you have a risk. We'll be doing follow-up on you. For example, if it's breast cancer, we'll be sending you for a mammogram. Yes, and advise them. Now, follow-up scenarios. These are scenarios whereby the diagnosis is already known. For example, the patient is diagnosed with a convulsive disorder, or let's say diabetes. The patient is coming for follow-up. They are already known they have convulsive disorder, they're having DM, or they're having hypertension. In these types of scenarios, you're going to take a history as usual, examination as usual, but you're not going to come up with a diagnosis, because the diagnosis is already known. Patient is on medication, so what you want to do is either to add on their medication, remove some medication, or adjust the dose. And then finally, give advice. Combined stations. Now, these are stations where they are called combined because they are combined between history and physical examination. Now, in these scenarios, you will enter the station and either you will find a mannequin, or is going to be a real patient examination. So for example, the patient will give you a concern, I'm having abdominal pain. And when it comes to examination, when you say, I want to examine the patient, they will tell you, go ahead and examine. The patient will lie on the bed. Or for example, if you say, I want to do digital rectal examination, they will show you a mannequin so that you can do. So the difference between this station and the history-based station is that on the history-based station, once you say you want to examine, the examiner will give you findings on a piece of paper. So you will not examine, you will only take history. Yes. Semen. So semen, this is called simulator mannequin. I think you've seen this thing on a lot of trainings in Kenya, like EMONK. So it is a mannequin lying down. It can talk, it can respond to you. So on semen, they're basically assessing A, B, C, D, E. So the patient will have an issue with airway, breathing, or circulation, or CNS issue most of the time. So airway, either asthma, either an allergy, anaphylactic shock, an airway issue. Breathing, either asthma, circulation, bleeding, PPH. Yeah, disability, either a patient who has overdosed on morphine. Yes, and therefore you have to act quickly through ABCD method. Yes, we will continue to talk about prescription in the next video. Ethics, angry patient, problematic colleague. Thank you.